Ozempic is extremely popular for weight loss nowadays. Celebrities use it, creating massive enthusiasm among people. The craze around Ozempic is due to its simplicity and effectiveness. It's a once-a-week pen injection, simple to use, quickly and effectively suppressing appetite. I will tell you when and why is Ozempic most effective. What are the major challenges and limitations of it? What risks if you intake it for long term? And what are the better alternatives? However, Ozempic isn't officially approved for weight loss. It's approved to treat type 2 diabetes. Ozempic mimics a natural hormone called glucagon-like peptide 1 or GLP-1. This hormone binds to cells in our intestines and brain, creating the sensation of just having eaten. It strongly suppresses appetite, slows gastric emptying, giving a sense of fullness. Ozempic also increases insulin production, lowering blood sugar after meals. It decreases glucagon, a hormone that normally raises blood sugar, by releasing stored glucose from the liver. So, blood sugar levels stay lower, helpful for diabetes management. Ozempic may also offer other health benefits, reducing inflammation and decreasing heart disease risks. Ozempic is the brand name. The actual molecule is called Semaglutide, which is the generic form. Semaglutide has several brand names: Ozempic, Wegovy, and Rybelsus. Among them, Wegovy is specifically approved for weight loss. Rybelsus is the oral tablet form of semaglutide. Wegovy has a slightly higher dosage, but no major differences otherwise. Ozempic gained popularity due to effective marketing and insurance coverage for diabetes. The oral form, Rybelsus, is slightly less effective for weight loss, taken once daily in the morning. Effectiveness varies among these three. Rybelsus is the least effective, averaging about 8% weight loss per year. Ozempic is moderately effective, around 13% per year. Wegovy is most effective, around 16% weight loss per year. All three are popular. Rybelsus as an oral alternative. Ozempic has first mover advantage. Wegovy is most effective, but also slightly more side effects. Common side effects include diarrhea, nausea, and constipation. Ozempic is safe to use for about 4 years. Ozempic's average monthly cost without insurance is around $1,000. But in some countries, it's cheaper. In Georgia, for example, a 3-month supply costs around $500. Ozempic is usually prescribed for people with a body mass index over 27 who also have risk factors like heart disease or diabetes. Semaglutide's core patent expires by 2026, allowing generic production from 2027 and an expected significant price drop. By 2033, secondary patents like pen design and intake methods will expire, lowering prices even further. There are even newer and more effective weight loss medications than Ozempic. Tirzepatide is currently the most effective, around 22% weight loss per year. Its brand names are Mounjaro for diabetes and Zepbound for weight loss. The difference between Ozempic and Tirzepatide, like Zepbound, is important. Ozempic mimics one hormone, GLP-1. Tirzepatide mimics two hormones, GLP-1 and glucose-dependent insulinotropic polypeptide, GIP. This dual action further improves insulin response, reduces appetite, and enhances fat burning. Side effects for both medications are similar and common: nausea, vomiting, diarrhea, and constipation, around 25% of cases. Serious risks like pancreatitis or gallbladder issues are rare, less than 1% of cases. Semaglutide has been studied longer, since 2017 for diabetes and 2021 for weight loss, providing more long-term safety data. So far, Tirzepatide doesn't appear less safe based on available studies and real-world data. Now, the recent safety concerns about these medications. Mounjaro and Zepbound are new, approved in 2023, so long-term data isn't available yet. Ozempic has a longer history. A recent rare concern involves non-arteritic anterior ischemic optic neuropathy, a sudden, painless loss of vision in one eye. This occurs when blood flow to the optic nerve is blocked or reduced. There's no confirmed mechanism yet linking these medications to vision loss. Investigations continue due to several cases among millions of users. Rapid weight loss or dehydration could lower nighttime blood pressure, reducing optic nerve blood flow. GLP-1 drugs might cause fluid shifts or affect small blood vessels. The concern: once vision loss happens, it's permanent with no treatment available. Normally, such vision loss affects about 10 people in 100,000. Ozempic users have about 3 times this risk, a 300% increase. Although the absolute risk remains low, the relative increase is significant. Exact causes aren't confirmed. It could be fluid shifts affecting the optic nerve or even direct effects on the optic nerve itself. Other serious but rare side effects include pancreatitis, severe abdominal pain, and vomiting. Gallstones and gallbladder inflammation occur more commonly, 2-3%, due to rapid weight loss. Another concern is thyroid cancer risk, observed in mice but not confirmed in humans. Still, a warning exists due to a potential increased risk of medullary thyroid carcinoma, a serious cancer. These medications are contraindicated for individuals with personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2, MEN2. But here's the key. If someone already has the MEN2 mutation, nearly 100% develop medullary thyroid carcinoma by age 40. Usually, individuals know their risk and thus avoid Ozempic. Specific genetic testing isn't recommended unless there's a known family history. Ozempic and similar medications offer hope and effective weight management, but awareness of these rare but serious risks is essential. Understanding these treatments fully empowers informed choices. It ensures better health decisions and safer outcomes.